Recurrent pulmonary emboli may lead to chronic pulmonary hypertension. Pulmonary hypertension of a precapillary type can be so severe that the massive enlargement of the pulmonary trunk and of the central pulmonary arteries can mimic the possibility of a mediastinal tumor, or can be confused with the presence of mediastinal tumor. In this frontal chest rentgenogram, observe the marked enlargement of the pulmonary trunk and the marked enlargement of the central pulmonary arteries. The periphery of the lungs are oligemic, and this is the pathognomonic sign of precapillary hypertension. Central enlargement of the pulmonary arteries and peripheral attenuation or peripheral oligemic. The lateral view of the chest of this patient revealed the marked enlargement of the pulmonary trunk, which is seen in front of the right pulmonary artery. Right pulmonary artery is observed on end in front of the esophagus. Note behind the esophagus the enlargement of the left pulmonary. This patient was suspected by a cardiologist to have hilar adenopathies. Note the marked convexity of the left pulmonary artery and pulmonary trunk, and also the convex right pulmonary arterial hilus. All these are enlarged pulmonary arteries, and what the cardiologist failed to recognize was the oligemic peripheral lungs. So that contrast between centrally enlarged arteries and peripheral hypovascularity is pathognomonic of precapillary pulmonary hypertension. This patient had chronic pulmonary thromboembolism. This is another patient with pulmonary hypertension. Note that there is a convexity in the region of the pulmonary trunk that is the result of a markedly enlarged pulmonary artery. The pulmonary arteries in the hila are enlarged. We do not see the left hilus because of the overlapping pulmonary trunk. The peripheral lungs are hypovascular. So this is a classic for precapillary pulmonary hypertension. This 8-year-old child had a nephrotic syndrome, and this is a frontal chest rentgenogram before he was subjected to treatment with corticosteroids. 4 years later, he had shortness of breath, and the frontal and lateral chest rentgenograms revealed signs of precapillary pulmonary hypertension. But the fascinating finding was to note calcification inside the right atrium and at the level of the pulmonary trunk and central pulmonary arteries. These represent calcified thrombi secondary to a hypercoagulability process probably related to steroids and other mechanisms.